Good afternoon, everybody. We're going to give it a few minutes while people begin attending and signing on to our Zoom. And after we've given it a few minutes for everybody to attend, we will start off with our translation services. So thank you again for joining, and we're going to give it a couple more minutes before we get started. Thank you.
Get a picture.
Again, thank you for joining NOLA Public Schools Vaccination Town Hall for Parents in anticipation and now the actual eligibility of our 5 to 11-year-old students for the COVID-19 vaccine. We're going to give it a couple more minutes for people to attend and sign on before we get started. And we'll start off with explaining the translation and the interpretation services that we'll be providing tonight.
Hi, my name is Vic Pham. I am a Vietnamese interpreter. I will provide Vietnamese interpretation this meeting. Tôi tên là Việt, tôi là thông dịch viên. Tôi sẽ cung cấp thông dịch cho buổi họp này. Nếu quý vị cần thông dịch, xin cho tôi biết. Xin quý vị
my name is.
Go ahead, Miss Emily.
Sorry, my name is Amelia Smith, and I will be the Spanish interpreter for tonight. Si a alguien le gustaría escuchar los procedimientos en español, por favor, marque al 978-990-5000. Otra vez el número es 978-990-5000. Luego hay que marcar el código de acceso y eso es el 707-717 y la tecla numeral. Otra vez eso es 707-717 y la tecla numeral. Y eso va a estar en el chat también. Gracias.
Thank you. And we will keep this slide up for the first couple minutes of our presentation, just so those who might be joining a little late can see those translation services and how to access them before them. And while we do that, I'd like to introduce our panel of speakers tonight. We are very fortunate to have such a robust group of healthcare heroes that many of you have heard through the COVID-19 crisis here with us tonight. First off, we have Dr. Avegno with the City of New Orleans Health Department. We have Dr. Finger with Children's Hospital, as well as Dr. Eric Griggs with Access Health, Louisiana. Dr. Ben Springate with LSU Health Sciences, also one of our NOLA Public Schools medical advisors, and Dr. Ryan Pasternak with LSU Health Sciences, also one of our medical advisors for NOLA Public Schools. So first off, I want to say thank you for joining us tonight. Really appreciate your time as we have a very, very important conversation with our parents about all of the benefits and the processes of having their youngest children and our youngest students vaccinated. My name is Tiffany Delcourt. I'm the Chief Operations Officer for NOLA Public Schools, and I've been serving many roles related to COVID-19. So I'm very happy to be with you tonight. And parents, thank you for being with us tonight. We really hope that we're able to answer most of your questions. So given that, I will go ahead and kick us off. Dr. Avegno.
Thanks, Tiffany. It's great to be back with everyone talking once again about COVID and vaccines, but now focusing on a younger age group than when we last talked. So I'm going to lead off and just give an overview of where we've been and where we are in terms of the outbreak. Next slide. So this is very familiar to most of you, I'm sure. This is our curve, which shows the average number of cases per day throughout the pandemic. And you can see that we have indeed finally come down off of what was a very devastating Delta surge, either our third or our fourth surge, depending on how you look at it. This is for Orleans Parish. The graph for Louisiana looks a little bit mostly the same, but with higher numbers in some cases. What Delta taught us is that the pandemic isn't over just because we'd like it to be over. And in fact, although we were very well controlled in terms of viral outbreak for a long time in the spring, when the Delta variant emerged, it did so in more devastating ways than I think we really anticipated. Namely, the effect on children. During the Delta surge in New Orleans and in Louisiana, around 25 to 30% of cases were in children. That's something we really hadn't seen in other parts of the pandemic. And if you remember that very frightening 10-week or so period, our pediatric hospitals were full, which is something that in my years of being a practicing physician, I'd never seen. And there were some very sick children in the hospital. And many of us had children or knew children who were sick with COVID, as well as a whole lot of adults. We're at a good place now, and there are reasons why we're in a good place. Particularly in Orleans Parish, we have very high underlying vaccination rates of our eligible population. Both adults and our 12 to 17-year-old rates actually lead the state, which is exciting. And we have a vaccine mandate in place for many high-risk sectors. We have a public school system that takes testing and guidelines and COVID precautions very seriously. And so I think we're in a good position, just as we were last fall. But we know, as we saw last year, that we have to be very cautious heading into the winter, heading into the holidays. And certainly we can't be naive to think that the pandemic is done with us again. Next slide. So just to reiterate where we are in terms of vaccination coverage, this is for all New Orleanians of the city. We know that until yesterday, only 12 and older were eligible. And our rates are quite good when you look at the rest of Louisiana and the rest of the country. Over 2/3 of all residents, even those not eligible, have received a vaccine, and over 60% are fully vaccinated. When you look, however, at the 0 to 17-year-old population, it's a much different story. And that makes sense, since until yesterday, most of them weren't eligible. But currently, less than 18% of our kids are fully vaccinated. So where our adults and those 12 and over have a much higher vaccination rate, our kids are still at risk. And so now we have finally the tools and the opportunity to give our kids the same level of protection that we've enjoyed. Next slide. This is a bit of a busy slide, and I apologize for that, but I just want to highlight how Delta really has changed the game. The original strain of the coronavirus, once we started to understand it, we discovered that on average, one person infected with the original strain of COVID would go on to infect 2 or 3 others. This is similar to the rates of the common cold or the seasonal flu. So it was about as contagious as those diseases that certainly we all are very familiar with. The Delta variant, however, has proved to be significantly more transmissible, to the tune of one person infected can infect up to 5 to 9 people with the Delta variant. And that's why we saw such a devastating surge in Louisiana, where one person in a household got coronavirus, everyone in the household, and lots of other folks did as well. That means it's going to take more of us to get vaccinated to have that full protection, what some refer to as herd immunity. But really, when we're talking about community protection to the point that we have with other preventable diseases, like measles. Measles is highly, highly contagious, but we don't see many measles cases because we have a very high rate of vaccination. And so that's what we're aiming for. We don't anticipate ever getting to 0 COVID cases, but if we can keep it to very low numbers with our baseline high levels of protection, then we're not going to see the recurrent outbreaks as we've seen over the last 18 months. Next slide. So now I'm excited to turn it over to my friend and colleague, Dr. Eric Griggs, to talk about the development of the vaccines themselves.
So first of all, thank you, Dr. Avegno. Before we go on, I want everyone to do me a favor and take a deep breath. Breathe in and breathe out. Phew. Do it one more time. Breathe in and breathe out. Phew. And the last one is for all the mom and dads that have been waiting for this day, that have been asked by their kids, ages 5 to 11, when can I get my shot? When can I get my shot? Well, here we are. You know, it's a pivotal time for us that we've been living through, and there's been a lot of changes, but a lot of things haven't changed over the course of this this pandemic. It's interesting that we use the term ancestral vaccine, and it's only been 20 months. Like, things, doesn't it seem like a long time? 20 months feels like 20 years. So when we talk about the vaccine development, this time last year, ironically, we did not have any choices. We'd hear about them, and we were waiting for the day that we would. Early on in the pandemic, we heard that there was a new technology potentially that could be game-changing using what was called mRNA technology. Now, I've done well over a decade of clinical trials, and they normally take a long time. And it takes a very, very, very long time, A, to get the number of volunteers for the clinical trials, and B, to get the resources in order to do that. Well, lo and behold, this happened. The entire world was looking for a solution. We had more volunteers. I've never experienced anything where you have over 100,000 volunteers for the sake of one drug to be developed.
Dr. Griggs, there you go.
Yeah, that was my, I had COVID on my computer and it went and muted me. So where we had a number, 100,000 volunteers, unlimited resources, everyone looking for a solution, and lo and behold, we worked. It worked. We got the genetic code from China, and the mRNA technology actually consolidated, and we were able to get it quickly. And in December of last year, we had the vaccines. Pfizer started, then Moderna, then J&J. And we de-escalated now to the point that we've gotten to with the kids. Traditional vaccines take years to complete, but I want people to understand that, again, I need to reiterate this point over and over again, that there are no steps skipped in this. And as you can see in the slide, there were overlapping phases, phase 1, phase 2, 2, 3 hybrids, first time in human, safety and efficacy, and then larger numbers to make sure that they're safe. And they were all taken, multiple vaccines. And I don't want people to think that these were the only vaccines that were developed. Once that happened, the FDA then looked at the vaccines to make sure they were safe in humans. And that's why you're hearing over the last few weeks, the FDA will meet, they'll look at the data, they'll convene a panel, and then they'll talk to the CDC, and then they talk to the Advisory Committee on Immunization Practices, which is ACIP, to make sure to give out the recommendations. And then once that happens, we get what's called emergency use authorization. Next slide, please. mRNA vaccines. I like to talk about mRNA vaccines in terms of bad little Dr. Eric. At 2 years old, my grandmother was be in the kitchen on Sunday mornings, wanting to know what my grandfather wanted to eat. And I was the messenger RNA. Go see what your granddaddy want. He wanted roast beef, green beans, and potatoes. And I'd run in the kitchen from the back room, run in the living room. What do you want? Roast beef, green beans, and potatoes. And I'd run to the back, tell grandma, and lo and behold, for dinner that night, we'd have that. Well, that's basically what happens. Messenger RNA is a bad little me in diapers with big old glasses, going to give the message to what's called the ribosome, which is the kitchen. The messenger RNA is wrapped in protein and fat. Once it's injected, it gives the code or the recipe for the spikes that are on the outside of the virus, so your body can mount an immune response, like a practice run, in case it actually runs into it. The immune system recognizes that protein, thinks it's being infected by the virus, and it starts making antibodies to fight the virus. Then once it figures out it's not being infected, it knows how to better recognize it. If you want to think in terms of football and the fact that we're going to beat the Falcons this weekend, it's like football practice. When you run their plays, when you actually see them, you know what to expect and you can be victorious. Next slide. The big thing, once it happened, it was determined that were 2 doses needed for the mRNA viruses, the Moderna and the Pfizer, like you'll hear soon with the Pfizer with the kids. People were worried about side effects. Well, what happens is, as you take those the immunizations, the first shot introduces the concept. The second shot, your body knows how to fight it. All of the side effects that you feel, the pain at the injection site is normal because it's a needle. The fatigue, the headache, the fever, the chills are the result of your immune system being activated and being prepared and learning how to fight. 85% of people with the Pfizer had the side effects. 91 experienced more than that. Dr. Avegno gave me my first immunization, and I had all of those because apparently I'd been infected before. My body knew how to fight and was ready to fight. And sure enough, it did not mean that I had COVID, but that my immune system was ready to rumble. And 2, the other thing is that, once I took my over-the-counter medications and got a lot of rest and water, that my side effects resolved. And at this point, we literally have given billions of doses of the vaccines with a remarkable safety profile, meaning they're safe and nothing happened, but other than people being protected. Next slide. Now, how did we get to where we are? So the FDA looked at the data on kids ages 5 to 11, and they studied the first group, and 2/3 of them got the vaccine and 1/3 got placebo, which means they did not get the vaccine. It was a double-blind study for 2 months after the second dose. Then they had another 2,250. So that's a 4,500 kids enrolled later. And it was actually studied during the Delta surge, which Dr. Avegno talked about, has become what we learned was more infectious and potentially more deadly than the first one. So it was given during the surge. 1/3 of the adult dose was given twice, 3 weeks apart, and we found that 90% of the people that were given the vaccine were protected against symptomatic COVID. Next slide. No severe cases or side effects. 0 cases of myocarditis or pericarditis, which is the inflammation of the heart muscle or inflammation of the sac around the heart, or any other adverse events, which is good. We did have some of the normal side effects, and I say normal, they're expected side effects that we'd seen up to this point. And again, it only lasted 1 to 2 days. And just like we kind of expected and hoped, it was more common after the second dose, because by that time, your body is conditioned to fight. And so all of a sudden you get the second dose, your immune system's activated, and you get these side effects, which are actually protective. The conclusion is, as we know, the benefits outweigh the risks. And now you can have peace of mind, you can breathe, and we can protect our babies. Next slide.
Thank you, Dr. Griggs. And now we're going to throw it to Dr. Finger at Children's Hospital.
Thank you, Tiffany. It's an honor to be here. And after Dr. Avegno and Dr. Griggs, I appreciate the opportunity to speak to everyone. Well, in my role here at Children's Hospital, we've seen the early phase of the 18 or 19 months of this pandemic where children were uniquely unaffected severely by COVID. And then over the ensuing 1.5 years, we saw more and more children come in with severe cases of COVID-19 related illness and sequelae from it. We have the numbers from the CDC up in front of you, and here in New Orleans and across Louisiana, we saw much of the same trend. Most of the children who required hospitalization for COVID-19 are otherwise healthy children with no underlying medical conditions. We had a range from infants in the first few months of life to teenagers who are adult size get admitted to the hospital who were really, really sick. And just like this slide displays, we suffered deaths of children in New Orleans and in the state of Louisiana due to COVID-19. In fact, recently, over the last several weeks, the vast majority of children who test positive for COVID-19 are under the age of 12. I think in addition to this, we now know that children, even if they don't have symptomatic disease, can spread the disease to other people around them, whether it's their classmates at school or their own nuclear family members and friends. The Delta surge, which really started in New Orleans in late July and early August, hit us hard and we accepted many patients from across the entire state of Louisiana. Thankfully now that has resolved much, although we still do have patients with COVID-19 illness in Children's Hospital. Again, it's unclear right now if Delta was more aggressive or if there were simply far more children who were affected by it than in other phases of the illness. I suspect it's a combination of both, because we took care of many, many children who were much more severely ill than in any other phase of this pandemic. Finally, it's not just the acute illness of COVID-19 that can adversely affect children. There are two items that can happen later that have really caused problems. One is MIS-C, which happens when your body reacts to the virus that it had typically 4 to 6 weeks previously. We've seen that more severely in kids ages 6 to 16, and many of those patients have also required intensive care unit therapy. Finally, you've heard about long haulers. It takes most people who have severe COVID up to 6 to 8 weeks to begin to feel normal. And even in pediatric patients, 1 out of 10 still have vague residual symptoms more than 3 months after their initial illness. So I think with all of that data, it's no longer true to say COVID-19 is not a disease that affects children. It absolutely is. And right now, they're contributing to a large proportion of cases in New Orleans and across Louisiana.
Thank you, Dr. Finger. And before we throw it to our LSU Health Sciences doctors, Dr. Springate, Dr. Pasternak, I do want to say that we are managing the questions that you are putting in the question and answer. We are seeing them, we are collecting them, and when we get to our question and answer session, we're going to answer those verbally. So please keep putting in those questions. We are collecting them and filtering them, and we will get to those when we get to our question and answer section. So thank you. So Dr. Pasternak.
Thank you, Tiffany. And as Dr. Finger said, I appreciate being able to speak to everyone and talk about this topic and follow Dr. Vegno, Dr. Griggs, and Dr. Finger. I think talking about pediatric vaccines, I can't underestimate the benefit that vaccines have had in the health and healthcare delivery of young people in this country and across the world. I can say, just looking at this chart, one, recognizing that there are a number of vaccines that children get and are required in many cases for school attendance and other environments that are critical to protecting them as individuals and to protecting the children around them, both other healthy children as well as other children that might be around them in school and other environments that are less healthy. And even during, I'd like to think, my relatively short time as a physician in my career, a number of these vaccines are vaccines that were developed while I was in training or have come into practice during my time as a physician, including that Tdap vaccine, the Haemophilus influenza type B vaccine, pneumococcal vaccine, and rotavirus, and meningococcal vaccine. And I've seen the impact of each of those on prevention of disease. I used to see a lot of patients with severe Haemophilus influenza type B infections, including and meningitis infections as well, that we don't see as regularly in the hospital or in our clinics anymore as a result of these vaccines. And like those, the COVID vaccine has been studied widely, or as Dr. Griggs mentioned, maybe even more widely than many of these vaccines have been studied. I also think it's important to recognize that the vast majority of the vaccines that you see here in this routine vaccine schedule are all given before the age of 5. Most of these vaccines are given starting at birth and then in the first 6 to 9 months of life and then before age 4. Thanks. And then this is just a comparison of pediatric mortality among vaccine preventable diseases. So just looking back at the 1950s, you see average cases of 550,000, almost 500,000 average yearly cases of measles that resulted in about 450 deaths during that time. Post-vaccine, average cases cut down to 375. So just a massive decrease in vaccine or massive decrease in the disease prevalence due to this vaccine. Similarly for polio, we've essentially eradicated polio, at least in this continent. Rubella as well, less than 10 cases annually since the rubella vaccine was developed. That's included in the measles, mumps, and rubella combination vaccine. In COVID, we've seen over 6.2 million cases on an average yearly basis and 637 deaths since March of 2020. So if we can reduce that and cut that down, and that's deaths in children, that would be to a great advantage. Thank you.
And Dr. Springate, you're muted.
All right. Well, fortunately now I'm not muted. Thanks for that, Dr. Pasternak, Dr. Wagner, Dr. Griggs, Dr. Finger. Great to have the opportunity to be with you all today and continue this important discussion. Among what we've learned about pediatric vaccines is that they have incredibly strong safety profiles. There's incredible opportunity to track possible adverse effects because so many millions of children get these. And so we'll have plenty of opportunity to learn more about the COVID-19 vaccine moving forward. But everything that we've learned so far and the conclusion of the FDA, the CDC, and the experts who have reviewed the data from Pfizer indicates that the vaccine for children ages 5 to 11 is safe, is effective, and the benefits do substantially outweigh the risks. There have been a lot of false claims about many vaccines over time, including false studies. And we've seen a number of false claims about the currently available COVID-19 vaccine, but we have been fortunate to have the opportunity to see these debunked when we look further into the science. And the vaccinations have numerous benefits, both to the individual as well as to the society and to the people who are immediately around them. They can decrease child mortality and disease that can be spread to vulnerable adults. That's certainly true for COVID-19 vaccination. They can limit the likelihood of disability, such as long COVID or other longer-term side effects. They can have an incredible impact on education, such as preventing outbreaks at schools, which I know that many of our audience members, as well as we, are all concerned about today, and the associated learning loss. And fortunately, if a person is vaccinated, they're not going to have to quarantine if they are exposed in a school setting. They'll simply have to have follow-up testing, which is a tremendous benefit for families as well as for kids. When the kids get the vaccine, they're going to have a lot of positive impacts in our community. Healthcare workers are going to be relieved because we're not going to see as many full hospital beds, and they're not going to have those exposures to themselves in their workplaces. We know that high-risk residents and the whole family, a lot of families have people who are at high risk of COVID-19, people with chronic conditions or people who are older adults. And so this is going to protect those family members as well by having the children vaccinated. We'll be able to reduce that educational disruption and that repeated quarantine. And we're going to avoid both the serious outcomes that can come with hospitalization and serious illness, but also those longer term consequences like long COVID that, as Dr. Finger indicated, can occur in 10 to 15% of children. Really, we want to get New Orleans back to normal. This is really an opportunity for us to get back to a place where, this isn't going to be something that we're worried about day in, day out. And so much of our society and so much of our life is focused on it. We'll be able to go back to enjoying the things that make New Orleans a great place to live.
Thank you, Dr. Springate. So now we've taken some of the questions that we've received in advance that we've collected into these community questions, and we're going to popcorn these questions with some of our physicians on our panel. So first up, we have Dr. Finger with our first question. What was the risk of hospitalization in the Delta surge compared to other pediatric illnesses?
Thank you, Tiffany. It was unbelievable during the Delta surge what we saw. We went from 1 or 2 patients before the Delta surge to over a 72-hour period, having 20 pediatric patients in our hospital, which was about 15% of all patients in the hospital. So I would say it rivaled an aggressive viral illness of RSV, which we typically see in the winter months with the volume of patients that we saw clearly.
Thank you. And Dr. Griggs, you're up next. We've actually seen this question a few times in our Q&A function tonight. Can my child get a COVID vaccine and a flu shot at the same time?
The answer is resounding yes, they actually can. And I'm glad that someone's asking about getting the flu shot. You know, this time last year, we didn't see much of a flu and we didn't have a vaccine. And it was because of our, excuse me, public health practices, as I cough, right? Public health practices. We were masking, social distancing, being responsible. So the answer is absolutely yes. Please get your child a flu shot and get one for yourself.
Great, thank you. And Dr. Springate, should my child get the COVID-19 vaccine if they've already had COVID-19?
Yes. So we know that while some people are convinced or have been hearing, for example, that there is a benefit to having already had COVID-19 as far as having some sense of immunity to future infection. We know that immunity is not nearly as effective as that from vaccination. And as it turns out, a study released just this week indicated that a person who is vaccinated has 5 times greater protection, is 5 times less likely to get a follow-up infection from COVID-19 compared to someone who has immunity only from a prior infection. So getting vaccinated, it makes a huge difference as far as protecting your child and your family from future infection. So yes, even if someone has had prior infection from COVID-19, your child included, they definitely should get this vaccination.
Awesome. And Dr. Finger, can you talk about the risk of myocarditis with COVID and vaccines?
Sure, absolutely, Tiffany. There clearly were reports early on and throughout the phase of the vaccination campaign of episodes of myocarditis, meaning heart inflammation after specific types of the vaccine. However, we saw many more children have myocardial or heart involvement due to the virus of COVID-19 than we saw have this incredibly, incredibly rare side effect, which is why the CDC and the American Academy of Pediatrics continue to recommend the COVID-19 as extraordinarily safe. In fact, those patients who had this, possibly due to the vaccine, all recovered relatively well, as opposed to children who had heart involvement due to COVID-19 were incredibly sick. So the risk far is outweighed by the benefit.
Dr. Finger, I'm going to stick with you because we did have a very specific parent question that we received from our vaccine updates email, and it's related to myocarditis. So I want to read it out just so we can get that answered. A parent has a 10-year-old son with a heart condition and enlarged aorta that requires annual monitoring from a cardiologist. What does the CDC recommend with regard to the vaccine for this parent's child's pre-existing condition?
They're currently recommending that you discuss it privately or you discuss it directly with your own pediatric cardiologist. There is no absolute contraindication, even in children like the child who's described with an underlying congenital heart condition, from getting the COVID-19 vaccine. But if you do have more specific questions, I anticipate your specific pediatric cardiologist will be able to answer it and almost certainly direct you to advocate for getting the vaccine.
Thank you. And Dr. Grid's going to toss it back to you. So I know some of the FDA approvals can be kind of confusing. So which vaccines will actually be available to 5 to 11-year-olds?
So it is Pfizer. I know there are a number of options out there, but it's the Pfizer vaccine for kids ages 5 to 11. Really simple. It's 2 doses, 3 weeks apart. It's Pfizer. I'm going to keep it simple. It's Pfizer.
Thank you. And Dr. Finger, where can a parent get their child vaccinated?
There's many locations across the area, and we are anticipating arrival of the vaccines here in New Orleans tomorrow from the state of Louisiana. So thrilled about that. Children's Hospital clinics will have them available for existing patients Monday through Friday, as well as for patients and non-patients available on Saturdays at locations across the greater metropolitan area, and appointments can be made online. I do know that there are many other clinics as well as pharmacies who are hoping to give the vaccine. I just can't comment, Tiffany, on the specifics of when those folks are receiving the vaccine.
Absolutely. And Dr. Avegno, we received many questions about this in the Q&A while we've been speaking. But what does this all mean when it comes to if kids should continue wearing masks in school?
Thanks, Tiffany. Yeah, we've gotten a lot of questions about that too. There's a lot of reasons. Number one, the CDC absolutely strongly recommends continued mask wearing in school settings for everyone, kids, teachers, visitors, parents, based on some significant evidence and studies that they've done and all over the country have been done that shows that schools that had strict mask wearing policies were far less likely to have outbreaks. And when you have fewer outbreaks, you have fewer kids in quarantine, you have fewer kids on virtual, you have less learning loss, and certainly you have better health. So it is we always follow the science, and the CDC could not be any clearer about that. The other reason is because if you look at the vaccination rates, as I presented earlier, 0 to 17-year-olds in New Orleans have less than an 18% vaccination rate, whereas our adults are far higher than that. So when we're talking about settings that are predominantly children, they are still not protected. I know that the governor removed the mask mandate for most other sectors, other than K through 12, healthcare, and of course, public transportation. We continue to have a vaccine mandate in the city for high-risk sectors so that when you walk into a crowded public indoor space that you're not wearing a mask at, we know that you have to show that vaccine for adults because it's going to protect the kids that are there. When you're walking into a school and nobody is vaccinated in that class except for the teacher, that's a very different level of protection. We do hope that as pediatric vaccination rises and meets that or gets close to what we have in adults, then it's certainly a much safer environment for kids to be in all day without a mask. But again, right now, we're going to stick to the CDC recommendations that state that mask wearing in schools ages 2 and up is essential.
Great. And last question to you, Dr. Avegno, as well. If my children receive their vaccines, can we have a normal holiday season?
Well, the great thing about this authorization is that it comes right in time for the holidays. If your 5 to 11-year-old gets vaccinated in the next 2 weeks, then they will be fully protected by Christmas Day, which is really the best gift that Santa could bring any of us. When your family is fully protected, that makes the risk of you going to a holiday gathering with vulnerable individuals, so older, those with certain medical conditions, there's those with immune compromise, much safer. We know from data that the more people that are vaccinated within a household, the better the entire household is protected. So if only 2 or 3 out of a 5-person household are vaccinated, then the risk of everyone catching COVID is much higher than if everyone was protected. So yes, I truly believe that as we look to the holidays, as we look to hopefully Carnival 2022, the more kids are vaccinated, the better protected we're all going to be and the more normal it's going to feel.
Thanks, Dr. Avegno. And we have been collecting the questions that have been coming through, and I kind of want to ask some of the specific questions that we've received from some of our parents. The first one, and this one is, I'm going to throw it to you, Dr. Finger. I have an 11-year-old who turns 12 in 2 weeks. should they receive the child dose or an adult dose, and why is it different?
Sure. So the dose that's been approved for 5 to 11-year-olds is about 1/3 the amount of the adult dose, which is what's given to kids over the age of 12. The CDC was very specific about the approval process and actually discussed the scenario and the question yesterday at their committee meeting. It's age-based and not weight-based. So if you present in the next 2 weeks with your child while still 11, they will get the pediatric dose, i.e. the one that's been approved for 5 to 11-year-olds. And then 3 weeks later, when you present for the second dose, they will get the dose that's approved for the 12 to 17-year-olds. We have encouraged all providers in the state not to deviate from that recommendation. So there aren't people giving it willy-nilly based on what they feel like. So that's the recommendation. It is an age-based vaccination dose, not a weight-based or anything else.
Got it. And I'm going to let our doctor self-select who's going to answer this next question. So we're all very excited that we now have eligibility for our 5 to 11-year-olds. But what about our children younger than 5 years of age? What do we think the timeline or the process is for our youngest children to be eligible for a COVID-19 vaccine?
I think what it looks like is somewhere in mid to late 2022. I think the enrollment process for that age group has not nearly been as aggressive as it has been for kids over the age of 5. And now that we have waning amounts of COVID in the community, it potentially could take a little bit longer to get the necessary data that the vaccine producers need in order to present it to the Food and Drug Administration and subsequently the CDC, but likely at some point in mid to late 2022.
Thank you. And Dr. Pasternak, I'm going to give this one to you. When would a child receive the full benefits of receiving the Pfizer COVID-19 vaccine? And should parents expect that their children will need a booster in 6 months?
Yeah, so I saw that booster question, and that's a good one. So I think we don't have the data yet to anticipate or expect a booster at this point. So generally, we say about 2 weeks after completion of the second vaccine, most persons have good immunity going forward, but I think we'll still be studying for some time. I don't know if Dr. Griggs has additional data on that, studying for some time the effect of the vaccine and if there's a waning effect over time that requires a booster.
I think that this vaccine protect against this newest variant that we've been seeing in the population?
We lost you, Tiffany. At least I did.
Can you hear me now?
Yeah.
Okay, thank you. So this is for Dr. Springate. So we have been hearing about a new Delta variant or Delta Plus variant, AY42. Do we think that this vaccine will protect children against this most recent variant?
We're certainly going to have to continue to monitor for additional variants. So far, we believe that the vaccinations that have been tested and have been approved have substantial effectiveness against the most widely spreading variants. But I don't have any data that spells out anything clearly about emerging variants such as this. I don't know whether Dr. Finger, Dr. Griggs, Dr. Avegno, or Dr. Pasternak do. And
there's no data thus far to show that it is not going to be aggressively responsive against the current variant. So it's shown to be protective against all variants thus far, which have mutated by the same way. We suspect it will be the same for this one.
And I'll just add, one of the distinguishing features of the pediatric trial is that it was largely conducted when Delta was the prominent strain, unlike the vaccines that all of us as adults received, which were conducted and given mostly before Delta was even on the radar. And the fact that the efficacy of the pediatric vaccine against Delta, which we know to be more highly contagious, was 90+%, is a really good indication that it's going to hold up against some of these tougher variants.
Thanks, Dr. Avegno. One question that we've gotten really specific to women and adolescent girls. So some women have reported changes in their menstruation cycles after getting the COVID vaccine. Does this vaccine affect fertility in women or in young girls? And would it also have any long-term effects in premenstrual girls?
So I can start off. There is zero evidence that this vaccine affects fertility in any way. In fact, there's research that was just put out that showed that many, many, many women were pregnant, conceived during or after vaccine, and that rates of pregnancy loss were not at all different between those who received a vaccine and those who didn't. The myth of infertility is just that, a myth. There's nothing in this vaccine or really any other vaccine that would cause it to have effects 10, 20 years down the line. That's just not the way vaccine or most medical therapies work. And so there is absolutely nothing to indicate that a vaccine given today would cause problems with fertility 10 or 20 years later. I will say that I'm the mother of 3 preteen and teenage girls, and I gave it to them without hesitation of what might happen to their fertility later, because there's just no science or data to back that up.
And I'll follow that up. Running a clinic for young girls with menstrual disorders or fertility concerns, I've yet to see, and really encouraging all of them to get the vaccine, I've yet to see one patient present with menstrual issues related to the vaccine, or even from a timing perspective. And again, we're encouraging, fertility is one of the main goals of that clinic, and we're encouraging every single one of our patients to receive the COVID vaccine.
Thanks, everybody. So of our questions, the majority of them are kind of about the district's policies and the district's process for providing COVID-19 vaccines to our younger students, which we are going to cover in our last few slides together. But while we have a little bit more time, Dr. Avegno, is there anything additionally that you want to share with this group? I think that's kind of covers the majority of our vaccine-focused questions, but is there anything you want to share before we close out and go to the end of the presentation?
I would just highlight the importance, again, of the spectrum of vaccination. And that's, everyone, we know that COVID makes all of us vulnerable. Certainly our elderly folks, those with immune conditions and high-risk conditions have been more vulnerable. But what we saw as we presented is that the spectrum from newborn to the elderly. And so as we're encouraging our pediatric vaccines, we are also encouraging boosters for those who are eligible, particularly our seniors. We know that when we do see breakthrough cases, it has a disproportionate toll on our seniors. So if you are relatively young and healthy, have a full vaccination series, you were likely to do just fine, even if you did have a breakthrough case. But we know our seniors, and this has been borne out by data all over the world, really benefit from that booster dose. And so as you're considering taking your 5 to 11-year-old to get their vaccine, maybe it's time for them to go with grandma and grandpa to get their booster. Because certainly our elderly have suffered tremendously from this pandemic. And just now, as we're beginning to emerge from it, we want to make sure that we're giving them all the protection they've got.
Thanks, Dr. Avegno. And we're going to roll into the last few slides, which are really about the opportunities and resources NOLA Public Schools is going to make available for our students over the next few weeks. And I'm going to leave my video off as I'm having a little bit of internet issues, and I want to make sure that everybody can hear everyone clearly. So first off, NOLA Public Schools is committed to continually to providing community resources to aid in the distribution of COVID-19 vaccines, especially to our youngest learners. Just some information on the level of coordination that we've done so far. To date, NOLA Public Schools has coordinated over 3,500 vaccinations for our staff and over 1,200 vaccines to our older students. However, this rollout of vaccine will be slightly different. Due to the younger age of this recently eligible group, we want to ensure parents can be present for vaccinations in ways that they couldn't be for some of the mobile vaccinations we were doing at schools. So to allow for that to happen, we're going to be focusing on providing vaccination clinics and resources on weekends and during school holidays across multiple school locations so that parents can be with their children during the vaccination process. Vaccination events will also be open to all students, regardless of where they go to school. And so the vaccine event will not be specifically for the school that we're having it at. We just want people to be able to go where it is most convenient for them in the timeline that works best. So that's how we'll be slightly different. We're going to be focusing on providing vaccines when parents can be present, and that any parent and any child can come to any vaccine event we have at any school across our system. And so here's a little bit about our timeline and the resources that we'll have available. So we all know that as of yesterday, the CDC and FDA all provided their final approvals for having 5 to 11-year-olds receive the Pfizer vaccine. Unfortunately, because that happened in the middle of the week, many of our healthcare providers aren't getting their vaccine doses until this weekend or early next week. So as a result, we'll host our first series of vaccination events on Saturday, November 13th across multiple sites. Parents will be able to see the calendar of all of our scheduled vaccine events, their location, the healthcare provider providing those vaccines. You can see that on our website at nolapublicschools.com/vaccinations, or you can follow us on Twitter, Instagram, or Facebook for more information. However, we do know that we will have our first and largest event at Arthur Ashe Elementary School on November 13th, 10 a.m. to 1 p.m. The address is provided here, and those vaccines will be provided by Children's Hospital. So we will have a Children's Hospital mobile unit at the school site on the Saturday, providing vaccines. We hope to have many more events, and that calendar of events will be available on our website. We are continuing to do a lot of other things to make sure that we are doing our job to curb COVID-19 in our schools. Every school within NOLA Public Schools is providing weekly surveillance testing. We are as a district providing about 15,500 tests a week to our school system, and we're going to continue to do that. And we also have our own schedule of on-demand, or if you are symptomatic testing, that's available at multiple locations. So we really hope that parents continue to sign those consent forms to allow for your students to receive their weekly COVID-19 test. We are with a combination of increased vaccinations and continued testing, we're really ahead of everyone else in this work and really setting the bar high. And for our parents who have been so engaged in this conversation, that have maybe already signed up your students for ongoing testing, I just want to thank you. I know our school staff, thank you for making sure that we're all doing our part, and we really appreciate that. So we've got about 8 more minutes. I think that's it. I'm going to go and just ask a few more questions that we've received. I think we've been filling those out as we get them. There's a few questions about district policy that I'm happy to take. One of them is, will COVID-19 PCR testing be available if there is an outbreak within a school? So right now we have 2 types of testing available in our schools. One is weekly surveillance testing that is not outbreak specific. However, we do have mobile testing sites for anyone who needs a test for any reason. Either you are symptomatic, you or your student are symptomatic, your child has been identified as a close contact and you want routine testing, anybody who's been exposed. Those testing resources are also available, and your school nurses are the best ones prepared to tell you about what those resources are and how you can receive them. And all of these resources are free. There was a question about, will vaccines be given at school? We just talked about that they may be given at school, but most likely we're prioritizing Saturday and school holidays. So we are thinking about the 2 days before the Thanksgiving break to have multiple vaccination opportunities available on that Monday and Tuesday as another opportunity and resource. And then also, if my child doesn't get vaccinated, will that keep them from being in school? So we really want to highlight that one of the benefits of being vaccinated is that if your child is identified as a close contact from a case at their school, if they are vaccinated and asymptomatic, they are not required to quarantine. Once you are vaccinated, there is no need to quarantine unless you become symptomatic. So it provides a lot of stability for our students who want to take part in more stable in-person learning. And we really want to highlight that benefit according to our policies and processes. Just scrolling through here for a few others. One question, and I'm going to throw it to Dr. Finger. How long do other or this mRNA vaccine last in children? Do we have any information?
So mRNA vaccines have been used with other viral illnesses, but not nearly in the volume that we've used the COVID-19 vaccine. It's clear from the studies in adults that there is some waning immunity that occurs after 4 to 6 months, as I think Dr. Griggs already alluded to in his discussion. More to follow with if we see the same pattern in children, but thus far the immune response in kids has been unbelievably great, although I suspect that we might be in line for boosters at some point. It's just too unclear to know at this time, Tiffany.
Thanks, Dr. Finger. Just scrolling through. We've answered the quarantine question. I think we've done a good job of answering these questions. Thanks, everybody. Dr. Avegno, I'm going to ask you to close us out.
Sure. You know, I just have to say it's been a very, very long, almost 2 years for everyone in many different ways, but particularly for our children. There was some recent data that illustrated that 1 in 4 children in this country have experienced loss of a loved one or significant illness to a loved one because of COVID. That's a tremendous toll that I think it's going to take us a while to really work through. And so the sooner we can come out of this for good, I think the better. You know, New Orleans has been so really courageous in the way that we face this. We have been great with wearing masks and really adhering to guidelines that were very difficult for a lot of different reasons, and it served us well. When the rest of the state and other places were really surging in Delta, we held the line and got through it a lot better. And so we're just asking everyone to come together as a community and to see this to the finish line. I have tremendous respect for pediatricians. I am an emergency physician, not a pediatrician. I know they are the experts on vaccines. I know that they are the experts on the effects of COVID in kids. We are really fortunate to have wonderful, caring pediatric specialists in the city. So whoever your provider is, that's who you should have real conversations with. They're ready, they're waiting, they're excited to talk to you, they're compassionate. They will work through your concerns, your questions, and get you to a place where you can feel really good about making the decision in a very challenging time. So I just encourage everyone, talk to your healthcare provider, talk to your trusted pediatrician, and thank you for allowing us to present this to you today.
Thanks, Dr. Avegno. Also, the recording of this webinar will be available on our website, our YouTube channel, NOLA Public Schools YouTube channel, as well as our social media. So we will be making this available widely and on many different sites. And so I just, again, want to thank everybody, and I want to thank our panelists so much for the information and the care that you've provided to our parents throughout all of this, and really thankful for your guys' leadership as always. I hope everybody has a great night, and we hope to see you at our vaccine site soon. Thank you.
Thank you.
Thank you.
Thank you.